Autism or ADHD or both? Real differences, fast. Today we'll break down 5 key differences, a quick recap, and a short quiz. Quick note, this video is educational, not medical advice. Talk to a qualified clinician for personal guidance. Autism involves social communication differences and restricted or repetitive behaviors. ADHD centers on inattention, hyperactivity, and impulsivity across settings. Yes, a person can have both. About 1 in 8 children with ADHD also have an autism diagnosis. Here's the countdown from number 5 to number 1, the clearest ways to tell. Number 5, social motivation. In autism, someone may prefer fewer peers, parallel play, or structured social time. The drive for connection can be there, but the playbook feels different. In ADHD, kids often seek friends eagerly, then impulsivity disrupts the moment. Talking over others, switching games midstream, or leaving before cues land. Think same classroom, different social drivers. If the day ends with, "I wanted friends, but it got messy," that pattern leans ADHD. If the day ends with, "I needed quiet, the group felt confusing," that can lean autism. Number 4, communication style. Autism shows differences in back-and-forth conversation and nonverbal cues like eye gaze, gesture, and timing. Topics may stay on a preferred interest, or responses can be one-sided without meaning to be. In ADHD, the pattern is often blurting, interrupting, and losing the thread, not deeper difficulty reading social cues. An ADHD child might know the rule, but impulse control lags behind the moment. An autistic child might value connection and still miss the hidden rules of turn-taking or tone. Number 3, interests and behaviors. Autism tends toward intense, narrow interests and a love of routine. Those interests can be joyful, soothing, and deeply knowledgeable. Rituals and repetitive movements can regulate a nervous system and reduce uncertainty. ADHD more often chases novelty, lots of interests that change quickly. Sustaining effort on uninteresting tasks is hard, even when the person cares about the outcome. Picture a collector spending months on one topic versus a sampler jumping between 5 in a week. Which difference fits your experience? Social, communication, or interests? Comment one word below to help others feel seen. Number 2, cognitive flexibility versus inhibition. Autism commonly shows difficulty with sudden changes and shifting between plans. A last-minute schedule switch can cause distress because predictability is a support. ADHD more often shows inhibition and sustained attention challenges, stopping an action or staying with a task when distractions pile up. Both profiles can struggle in a chaotic classroom, but the reasons differ. If the routine changes and meltdown risk rises, think flexibility support. If the routine is fine, yet tasks drift despite best intentions, think attention and inhibition supports. Number 1, sensory and context. Autism frequently includes sensory differences. Lights, textures, sound, or crowded spaces can overwhelm, and a need for sameness to keep energy steady. ADHD symptoms must appear in 2 or more settings, like home and school, not just in one tough class. So if challenges only show up during algebra but not at home or sports, look at context first. If certain sounds always hurt or certain textures always irritate, add sensory supports. Noise-reducing headphones, sunglasses, or predictable routines can make a big difference. Here's your 30-second recap. Social motivation, fewer peers or parallel play can lean autism. Eager seeking with impulsivity can lean ADHD. Communication, autism shows differences in back and forth and nonverbals. ADHD shows blurting and interruptions. Interests, autism thrives on focused interests and routine. ADHD pursues novelty and struggles with boring tasks. Flexibility versus inhibition, autism needs help with changes. ADHD needs supports for impulse and sustained attention. Sensory and context, autism often includes sensory differences and need for sameness. ADHD requires symptoms in multiple settings. Quiz time. Which condition requires restricted or repetitive behaviors as part of the diagnosis? Autism or ADHD? Answer: autism. Those behaviors, along with social communication differences, form the diagnostic core. If traits from both columns resonate, that's possible too. Co-occurrence happens and support plans may look different when both are present. Ask about a combined evaluation and a plan that matches strengths and needs. Remember that labels should unlock help, not limit expectations. How to use this in real life. At school, write requests that lower friction, written agendas, reduced noise, movement breaks, or clear visual schedules. At home, preview changes, post routines, and build in recovery time after busy days. For attention challenges, use short-timed work blocks and cue a single next step. For sensory challenges, offer comfortable clothing, quiet corners, and choices that respect preferences. Small supports stack into big wins. You are not alone, and clarity leads to better support. Drop your question for Part 2 and subscribe for parent-friendly guides that respect your child's wiring. We'll keep building tools you can use the very next day.